Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Nwaka. First, the highlights. More state governors receive COVID-19 jabs, harp on need to maintain non-pharmaceutical interventions. The NCDC announces no fatalities from the coronavirus in Nigeria last night as the country records lowest daily infection in 5 months. France and Italy join Germany and other countries to suspend use of the AstraZeneca vaccine as a precautionary measure. We begin with some positive news, and that is for the first time this year, the country recorded its lowest daily tally of cases last night. 120 new cases are the lowest since October 2020, when our daily figures were below 100. The Nigeria Center for Disease Control, NCDC, also reported that there have been no deaths from the COVID-19 related ailments since the previous 24-hour cycle. According to data published by the agency, the fatality toll stands at 2,013 after 4 people died on Saturday. While the country recorded 205 new infections on Saturday in 15 states, the total number of infections in the country is now over 160,000. In the meantime, 120 new cases are reported from 14 states, Lagos recording the highest figure, followed by Rivers and Kaduna, 25 and 20 infections respectively. You can find other states as well, Oyo, Plateau, Ogun, Nasarawa and Imo, that recorded cases as well. According to the center, the discharges today include 82 community recoveries in Lagos managed in line with the guidelines. More than 119 million cases have been reported around the world, with more than 2.6 million deaths. Last week, Nigeria commenced the vaccination of its citizens after receiving almost 4 million doses of the Oxford AstraZeneca vaccines. Now, the governor of Enugu State, Mr. Godwin Obaseki, has received the COVID-19 vaccine, also known as the Oxford AstraZeneca jab, as the state flags off its COVID-19 vaccination exercise. He explains that any risk associated with the Oxford AstraZeneca vaccine is worth taking in spite of some negative reports about safety, which he describes as the politics of vaccines. Mr. Obaseki led other dignitaries, including his deputy, the secretary to the state government, Speaker of the State House of Assembly, frontline health workers to receive their inoculation in a ceremony held at the Government House, Benin City.
As at this morning, when I was coming into Benin from Lagos, I received no less than 10 messages advising that I should not take this vaccine. Fortunately, as you know, Edo is very, very blessed and well placed with human capacity that understand the issues in this area. And over the last 1 hour, we've exhaustively gone through all the so-called risk issues relating to this vaccine. And yes, it may not be 100% foolproof. Yes, there may be some issues, because, the more than how many billion people on earth cannot have the same constitution. However, on the balance of risk, this vaccine is safe. And I decided this morning, against all pressure, to make myself available to take the vaccine. And I have done so.
Over in Plateau, the state commenced administration of the first doses of the AstraZeneca vaccine against COVID-19, with Governor Simon Lalong receiving the first jab at the Government House, Jos, the Plateau State capital. Governor Lalong also warned that taking the vaccine should not be a license to abandon the pharmaceutical protocols, such as the wearing of the face mask, observing physical distancing, and others. He emphasized that the vaccines are free and no one should be charged for receiving the doses. He was accompanied by his wife, Regina Lalong, and the Deputy Governor, alongside other government officials.
I want to reassure our people that as your governor, I will not subscribe to anything that will harm you affect your well-being. Rather, my number one priority is to ensure your safety and good health. That is why I and my wife, His Excellency Deputy Governor, the Right Honorable Speaker, the Chief Judge, traditional rulers and religious leaders, as well as heads of medical institutions in the state, and of course, security organizations, all of them are here, I'm sure, after they will take before they leave this place. We don't want anybody to be affected again as we move on to addressing insecurity in Plateau State. They are taking the first doses to show that there is nothing sinister about the vaccine. Finally, it is my hope that while we are continuing with this vaccination, NAFDAC will give approval to the submission by the Plateau State COVID-19 medical research team so that we can have our homegrown remedy for containing the pandemic.
Well, staying in the North Central region, frontline health workers become the first to be vaccinated in Niger State after receiving the first batch of the Oxford AstraZeneca vaccines. A total of 74,110 doses of the vaccines were received by the state government.
This is the first doctor in Niger State to receive the vaccination.
These are the first health workers in Niger State to receive doses of the AstraZeneca vaccines at one of the isolation centers in Mina.
Don't scrabble.
The Commissioner of Health, Dr. Mohammed Makumsidi, gives a breakdown of how the vaccination will be administered in the state.
We received a total of 74,110 doses. So for this phase, we are targeting frontline health workers, other health workers, people above age of 50 and above. And then the next batch will be those 18 to 49. And of course, there are certain key people that are relevant in this campaign, especially the president. You can see that Mr. President has taken his. And of course, in our case, Mr. Governor, and then the state executive, and those that will mitigate the fake news of either saying that COVID is fake, vaccination is fake, it has side effects and the rest. So if governor has taken it, definitely all those rumors will also be countered.
The first batch of the vaccine received can only cover 1% of the population in Niger State.
We already know the priority groups, and this is the first phase of this vaccination. We'll have a second phase, then we'll have a third phase, which hopefully we should be able to cover then up to 40% of the population of the state.
Some health workers who took the vaccine share their experience.
It's painless and it's almost free of any side effect as far as I'm concerned. As I'm standing here now, I'm not feeling anything. It's a normal process. And you know already that vaccination has been ongoing for ages. So this is not any different from the previous ones we've been having.
I've taken my vaccination and I don't think I feel anything bad in it. All right, for now, there is no any side effect in it. It is good. So I advise everybody should come and take their own.
From the isolation center, the vaccination team moved to the government house where Governor Abubakar Bello and his deputy received the first jab of the vaccine.
Congratulations, His Excellency. The Primary Healthcare Agency has done very well. This is about the first time, in my opinion, we're having the most effective and efficient primary healthcare administration. The management of the primary healthcare agency have been able to achieve our objective of one functional primary healthcare per ward in Niger State now.
In days to come, more people are expected to be vaccinated as the state sets a target of reducing the vulnerability of citizens in Niger State.
Over in Enugu State, the governor, Ifeanyi Ugwuanyi, received his first dose of the Oxford AstraZeneca vaccine. Alongside the deputy governor and the state's chief judge, they're the first government officials to receive the vaccine in the state since Friday, when the state commenced the inoculation of its frontline health workers at the ASU Teaching Hospital after taking delivery of over 65,000 doses of the vaccines from the federal government. Now, the Vice-Chancellor of the University of Calabar, Professor Florence Obi, has commissioned a 20-bed isolation centre to contain the spread of COVID-19 in the school premises and to offer immediate support to staff and students who present with COVID-19 related symptoms. Speaking at the university premises in Calabar, the Cross River State capital, the VC explains that the need to establish a COVID-19 isolation centre within the university became necessary following the renewed commitment by the federal and state government to tackle the spread of the virus. She expressed gratitude to the state governor for the donations to the university's COVID-19 task force team.
Today we are here to commission the completion of this isolation bay. I must say kudos to the team. The team has worked so hard. Let me also say here that when it became obvious to us that we're going to reopen, we had our Senate, and the Senate took decision that we have to have physical contact with our students. I was worried as a Vice Chancellor, and I thought that many other schools were not reopening for physical contact. Many had gone virtual and they don't want to take any risk. But since our Senate, the highest decision-making body of the university, decided that we have to go physical contact, have physical contact with our students, I set to work. I was actually proactive to make sure that we put in place equipment. We need to sensitize our students and staff, and we did that. And as much as it is meant for our students, we joined in prayers to say that we don't wish any of our students to be here. Yes. But we're only being proactive to make sure that the facilities are here in case we need to use the facilities.
Well, back to vaccination. The Nigerian Army has expressed optimism on the vaccination of soldiers on the front line in the war against insurgency. General Loki Rabo, Chief of Defense Staff, over the weekend was reacting to questions from journalists during his visit to the Military Command and Control Center, Operation Lafia Dole. He believes that the Presidential Task Force on COVID-19 will prioritize the soldiers. This is coming as advocacy campaigns for the COVID-19 vaccine continues, with frontline workers in the health sector in Maiduguri being vaccinated. And so far in Borno State, over 30 healthcare workers have taken their vaccine.
That I believe that the federal government has always thought well about us, about the armed forces. And so when the plans that the PTF has, I believe that they will factor the armed forces into it. And of course, the troops of Operation Lafia Dole will be a priority. So I think that perhaps you just be patient a little while, and we'll get back to you on it.
Still to come on the program, an infectious diseases specialist joins us for more on the trends on the virus and also the vaccinations. Do join us again. Dr. Yohan Akase, an infectious disease consultant, joins us on the program via Zoom. Welcome to the program.
Thank you very much. I'm happy to be here.
All right, let's start with Lagos. Vaccinations have started. Have you received yours? Do you know about those who have received and what their experience has been?
Well, personally, I'm yet to receive mine for logistic reasons, but I know quite a number of colleagues who have received, and so far it's been a pleasant experience. Everybody has got something good to say about the experience so far. So, yeah, I think so far so good.
But I'm sure you've been hearing reports, the number of countries halting the vaccination of the Oxford AstraZeneca vaccine, even though, according to some of these reports, there's no direct link to some of what they're experiencing, some of the patients, blood clots and what have you. I mean, the WHO is still saying, people should keep using it and that it is safe. But how much impact do you think that all of that news coming from Europe and some parts of Asia have with Nigeria and a few other countries that are receiving the Oxford AstraZeneca vaccine through the COVAX facility?
Well, I agree with you that news of countries suspending, and I can see that more countries have suspended that today. It will probably fuel those people who are already hesitant on taking the vaccine. And it's only responsible of any government or any country to be able to say, okay, we're seeing something here, even though we're not established in a relationship, but we don't want to take chances. So it's only proper to suspend while they are investigating. So, I mean, for countries who have experienced that, you can see that millions of people have taken the AstraZeneca, and the incidences of blood clots or other adverse effects have been quite, low, to say that. So, but really, whether it's one or two, no one should neglect that. Having said that, the data, and, when people look at data, you have to put that into perspective. Even the countries in Europe that have experienced blood clots or somebody else has died, to try to compare the incidences of blood clots to the general population, i.e. those that didn't take the vaccine. And in truth, there's nothing to suggest that those vaccines were directly responsible for that. However, like I said, it's only responsible of any government or the public health authorities to be able to say, okay, in order to be transparent and give people confidence to say that we've done everything, we've looked into everything, and we can confirm that there's no causal link. So it's only the proper thing to do. But countries who have not, experienced any of these side effects have no reason whatsoever to suspend vaccinations, knowing fully well that this is a risk-benefit analysis. And on the clear balance of things, it is way, way more beneficial to vaccinate people than not to vaccinate people.
But another thing also, I mean, the WHO Director General was talking about it today, saying that some of those reports coming in also means that the surveillance measures, the systems, I mean, there is an effective measuring system, surveillance in place, and that's why these countries are taking those decisions. But on the other hand, especially when you look at Nigeria, do you think that there is sufficient surveillance that is taking place as we vaccinate with this particular vaccine?
Yes, I think that's a very, very valid point. The truth being that since we are vaccinating, like they said, the incidence is the same in the population, those vaccinated and those that are not. So that they're picking it and also announcing it should give people confidence that, somebody is looking out for these things and picking it. In a country, yes, I would say, well, we're just starting. And it is left for us to be able to, demonstrate the same level of transparency, and, what's the word now, surveillance that I've seen elsewhere. However, that the sample size is not that big. All the states have received a number of doses, and they have clear records of everybody that have received the vaccine so far. It shouldn't be too difficult, to be honest, in knowing that, okay, of everyone that has received the vaccine, let's observe, give us the feedback, and there should be such a mechanism inserted into this whole process of saying, we're going to be in touch with you, or you be in touch with us, whichever way it is, of saying, how are you doing after a week, after a day, after a month, and they keep following other people until, and to be honest, we need to, it's not just to document adverse effects. We need to be able to say that in our country, of all the people that receive this particular type of vaccine, at the moment we only have the AstraZeneca with us, but we must be able to demonstrate after so number of months that of all the people that receive the vaccine, how many of them achieve immunity? You know, that somebody received the vaccine does not necessarily mean it's going to achieve immunity. So we need to be able to say we vaccinated this number of people. This is the percentage that developed immunity. How many of them eventually develop infection, especially those who are in the isolation centers and who have continuing exposure to COVID? How many of them eventually develop? It's a way of also testing the efficacy or the efficiency of the vaccines in people that have administered. So it's not just enough to go give somebody a jab and then send them to go home. You have to monitor those people closely for adverse events. You have to monitor them also to demonstrate efficacy of the vaccine. You also have to demonstrate, to demonstrate clearly that these people, of this number you've vaccinated, these are the number of people that develop this level of immunity. Because one of the concerns people have, and I've discussed with some of my colleagues, is that how effective is this particular vaccine, compared to the other one? We don't know in our own population, except, we monitor those people that have received and demonstrate clearly that in our population, in Nigeria, for example, there are some concerns around the kind of variants that are circulating in Nigeria, South Africa, and elsewhere. We must be able to show that all the people that have been vaccinated, this is the level of immunity they've developed, this is how long the antibodies can last, and all sorts of things. This is very, very good, important data. And, just to say that it's not just enough to say people develop side effects or not. We must and we have to. And that has been factored into the process. And I'm aware that has been done, to be able to say, okay, apart from adverse events, how many of you have developed immunity? How many of you got infected? How many of you were protected? And so on and so forth. So this is very, very important. So way and beyond just saying it was safe or not safe, we must also demonstrate eventually that it was effective, and because these are the two properties of a vaccine you want to test. One, you want to look at the safety. The second one, you want to look at how effective that vaccine was. And this has to be demonstrated very clearly.
Dr. Johan Akase, an infectious diseases consultant, thank you for joining us on the program.
Thank you.
France and Italy have joined Germany in becoming the latest countries to suspend use of the AstraZeneca vaccine as a precautionary measure. French President Emmanuel Macron said the country would stop administering the vaccine pending an assessment by the European Union's medicine regulator tomorrow. Italy's medicines authority halted the use of the vaccine nationwide. The decisions come despite the reassurances of UK regulators and WHO, which have said that there is no evidence of a link between the vaccine and blood clots. Here's more on our global update.
France and Italy have suspended the use of AstraZeneca vaccine as a precautionary measure. President Emmanuel Macron says the country will stop administering the vaccine pending an assessment by the European Union's medicine regulator on Tuesday. In the meantime, the number of COVID-19 cases in the country is still on the rise and intensive care units saturated. More on Europe. An Italian prosecutor has ordered the seizure of nearly 400,000 doses of the AstraZeneca vaccine after the death of a man who received the jab. The prosecutor in the Piedmont region opened a criminal investigation over the death of 57-year-old music teacher Sandro Tognati. His death prompted the suspension of the vaccine's use in the region on Sunday. China says it will continue to increase vaccine exports and aid to other countries and regions while meeting the domestic demand for vaccinations. Spokesperson for the Chinese Ministry of Industry and Information Technology introduced China's plan for vaccine distribution when answering questions at a press conference today. Finally, the coronavirus situation in Papua New Guinea is said to be concerning to Australia after 250 people tested positive for the virus from 500 tests done by the Australian health workers. Australia's Queensland reported that of 6 cases that tested positive in hotel quarantine today, 2 were from Papua New Guinea.
Let's now listen to the briefing by the WHO Director General, what he had to say about the Oxford AstraZeneca vaccine controversy.
Aware that some countries have suspended the use of AstraZeneca vaccines based on reports of blood clots in some people who received doses of the vaccine from 2 batches. This measure was taken as a precaution while a full investigation is finalized. It's important to note that the European Medicines Agency has said there is no indication of a link between the vaccine and blood clots, and that the vaccine can continue to be used while its investigation is ongoing.
Channels Television will continue to bring you the latest. Remember, you can find more updates, a better understanding of the pandemic on our website. That's channelstv.com. You can find several other stories there as well, as we indeed continue to take responsibility. That's the program this evening. Thank you for watching. I'm Millicent Walker. Stay safe.